Welcome to the press briefing on the COVID-19 disease. We have Dr. Libby Lee, Undersecretary for Health, Dr. Chong Chok Kwan, Head of Communicable Disease Branch of the CHP, and then Mr. Lau Ka Hin, Chief Manager, Quality Control. So Dr. Lee will first say a few words. Thank you. Good afternoon, members of the media and members of the public. Today, we would like to give you a report on a number of issues. First, I will invite Dr. Chuang to give you an update on the epidemic, and then Dr. Lau will also explain the healthcare system, and then I will also respond to certain discussions in the community. First, over to Dr. Chuang. Thank you. I will briefly talk about the epidemic in the past week. Now, in the past 2 weeks, the figures are more or less the same. There's a drop of 0.5% in the number of daily cases, and the figure is at the level of about 5,000 per day. As for local cases, there's a slight drop of 1.2%. So it's about 4,500 cases or so. As for imported cases, there's an increase, and it's an increasing trend actually. Compared to the previous week, there's an increase of 7.8%. So there are about 450 imported cases. And then imported cases account for 9.1% of all positive cases. And among all the arrivals, the imported cases accounts for about 4% of all arrivals. As for deaths, the figure is more or less the same. In the past week, it's 73 cases, and then the past 2 weeks ago, 73 cases. Past week, 70 cases. Mostly, the deaths, the disease, were those who did not get vaccinated. And from June to now, you can see that there is a drop in the number of deaths. It is about 0.12%. Then there is a notable difference between those who were vaccinated and those who were not. Those who have completed 3 doses is a 0.06% of death rate. As for those who did not get all the vaccination or not even one jab, then the percentage is 3.36%, so it's a difference of 6 times. So we're seeing substantial boost in vaccination rate recently, but still for the old and the young, we are very much concerned because for old people, the fatality rate is much higher, 20 times that of other age groups. As for children, as at yesterday, there were already 10 cases of children aged under 12. And 8 of those children did not have a single jab. So that's why we would like to take this opportunity to appeal to parents, the elderly, and members of the public to take their elderly and young and children family members to get vaccinated. As for Omicron subvariants, BA.50 accounts for the majority of cases, 86.3%. For other subvariants, especially for imported cases and local cases, there are different subvariants involved. For example, XBB, BQ.1.1. So we are closely monitoring the situation of local and imported cases. In the past week, for residential care homes for the elderly, there is a slight increase. In the past week, 44 institutions have seen 33 residents and 6 staff members infected. And then new confirmed cases, and compared to the week before, there's an increase. Schools, the situation is more or less the same. So in a week, there are about 3,000 cases and about 600 or so staff members infected. And the number of classes requiring class suspension, the percentage is more or less the same for 60, 70 schools. They have to suspend some classes for a week. Around the world, on the 19th of October, WHO determines that COVID remains a public health emergency of international concern, PHIEIC. As for the global number of cases, there's a drop of about 50% around the world. As for new deaths, that's a drop of about 10% as well. And around the world, BA.5 remains the predominant subvariant. For BQ1, we see a slight rise from to about 13.4%. XBB, there's also a rise to about 2%. For Europe, the pandemic remains more or less stable. BA.45 accounts for 90+% of cases. BQ.1, 11 point something percent. The UK, you can see that the index hospitalization rate, number of confirmed cases and deaths this is been stable, and BA.5 accounts for about 85.4%. BA.2 accounts for about 10%. In the US, the situation is also rather stable. In October, they continue to list COVID as a public health emergency. And they've extended this classification for another 90 days. In the Southern Hemisphere, New Zealand, BA.47, BA.578%. There's also BA.2.7 and other subvariants found. Singapore, that's XBB wave, but it seems that it's subsiding. There are at least signs of that. In summary, the number of local cases remain more or less stable. Imported cases, we're seeing an increase, and they account for about 4% of all arrivals. We are also seeing more subvariants in other places. In Hong Kong, we have also identified both local and imported cases involving this new subvariant, so we'll continue to monitor the situation. That's all by way of report. Next, Dr. Lau. Good afternoon. I'll give you an analysis of the confirmed cases. In the past week, there are about 1,930 patients in hospital. Every day, on average, about 200 new cases are admitted. In the past week, for critical and patients in critical and serious condition, it is about 70 to 80 patients per day, each day. And then we've also analyzed the admissions in the past week for patients admitted through the accident and emergency department. We have checked how many were infected, and also among the deceased, how many passed away because of some links to COVID. In the past week, from the 3rd to the 9th of November, there are about 1,040 confirmed patients admitted to hospitals via the accident and emergency department. And according to the assessment of doctors at the A&D department, also according to data reported, only about 60% of the patients were admitted because of COVID. In other words, for the remaining 40% of admissions through the A&ED, they may have been confirmed as having been infected, but they were admitted for other medical conditions. For example, their own underlying diseases, stroke or bone fracture due to accidents and so on. So for these 40% of patients, even if they are not infected, they will still need to be admitted because of their own medical condition, or because of the need for emergency treatment and so on. So they have to be admitted in any case. And then we have reviewed the 60 plus death cases in public hospitals in the past week. About 70% of the cases were more likely to be linked to COVID in terms of the cause of death. In other words, about 30% of the cases, our initial assessment is that the death could be caused by other causes, for example, terminal cancer cases, heart disease, or stroke. So for these patients, we believe that their deaths had nothing to do with COVID infection. For the 60 plus deceased patients, the majority of them were the elderly. The oldest was 104 years of age. Most of them had underlying conditions. And about 50% of the patients did not complete their COVID vaccination. So these are just preliminary data for our reference. This is for us to gauge whether to gauge the actual impact of COVID on the healthcare system. Now, our initial observation is that whether patients were admitted by the A&E department or patients who passed away in public hospitals, quite a number of them, about 30% of admissions and 30% of the disease. The condition had nothing directly related to COVID. So that's the initial analysis of the data for the past week. And we are able to gather more data. We may make some adjustment or there will be more detailed analysis. We will continue to monitor the situation and also analyze patients' data. We could then assess with greater precision on the pressure brought about by COVID on the public healthcare system. And then we could have regard to the actual situation and the medical needs of patients to provide suitable services. Having said so, the public must not let down their guard. Winter is approaching, and many experts have predicted that the COVID virus would become more active. In fact, you might recall that winter is also the peak season for seasonal flu, and we are entering into that peak season. In the past 2 years, there was no major outbreak of seasonal flu, but this year there's a high chance that COVID and seasonal flu would both be prevalent. In other words, the situation could be more dire than just having the COVID or the seasonal flu epidemic. Now, apart from appealing to members of the public to take the COVID vaccination, we'd also like to take this opportunity to appeal to certain individuals who to take the seasonal flu vaccination, because the vaccination helps to reduce the number of critical or death cases for COVID patients. Seasonal flu vaccinations has also been effective in the past to prevent serious cases and deaths for those infected with seasonal flu. Especially, there are certain groups in the community that would need the vaccination. For example, for those aged between 6 and 11, those above 75, or patients with chronic illnesses. And also, we would like to appeal to parents to arrange for the children to receive the COVID and flu vaccination as soon as possible. Otherwise, if they are infected by both viruses, there could be serious condition. There are now 4 community vaccination centers, including the Hong Kong Children's Hospital, now provide the BioNTech infant and children vaccine. So for those aged 5 to 11 or younger, parents could arrange for them to be vaccinated. There are also different vaccination centers that provide Sinovac vaccines. Both types of vaccine could provide enough protection to children. For children who have not completed vaccination, there is a higher risk of infection. And if they are infected with COVID, the condition could be serious. It could lead to encephalitis or croup. And then they may need to receive intensive care. And in severe cases, there could be deaths. And even if children recover, there is a chance of medium to long-term risks. So parents should arrange for their children to receive the 2 vaccines for COVID and seasonal flu as soon as possible. This is to give them added protection. As for public hospitals, as the pandemic starts to stabilize and the situation is under control, so public hospitals are gradually resuming various services. For non-emergency procedures and services have now resumed to normal. Thank you.
Dr. Lee. Regarding the adjustment to our infection control policy, we've always adopted a risk control approach. There are 3 different types of risks. First of all, personal risk. Secondly, the risks involving premises. And thirdly, risks involving activities. For the individual, we are talking about the possibility of a person transmitting the virus to other persons, and we are referring to those confirmed cases or the close contacts, and also, travelers coming from other countries which have infection. We have relevant policies, including the quarantine orders and also the health code arrangements. The second type of risk involving individuals it concerns the extent to which one could protect oneself, including whether or not one has received the jabs, whether one would observe personal hygiene and regularly put on masks. So these are the risks that we can control ourselves. But there are certain individual groups, for example, young children. So in terms of personal hygiene or the putting of surgical masks, we may need to help them. The third type of personal risks involve the the physical health of the individual. For example, for those who are senior in age or those who are immunocompromised, then there will be a high risk. Next, risk relating to premises. We're talking about premises and the ventilation in these premises. In open spaces and outdoor premises, we would have better ventilation. Whereas indoors, if you have a very crowded environment, the risk would be higher. So maintaining social distance, and in places where there are many people who congregate, we would need to manage those risks. Thirdly, risks relating to activities which do not require people to put on masks. For example, eating in catering premises. These are high-risk activities. All these three types of risks would need to be adjusted accordingly. For higher risk, how do we know that our risk control measures are effective? First of all, we would look at the trend of the number of new infection cases, and secondly, the subvariants of the virus and how they spread in the community, and thirdly, the number of death cases and serious cases, and fourthly, the extent to which the medical health system can manage, and fourthly, external risk. For example, whether we are going to have an outbreak of the seasonal flu. So these are the things that we will look at in working out our strategies. Looking at the situation in the last 2 weeks, we have had some large-scale activities, and the number of new infection cases still remain at around 4,000 to 5,000 per day. With regarding imported cases, the number has gone up as the number of incoming visitors go up, but roughly it's about 10%. Death cases, it's about 10 on average per day. The maximum was 18. For the majority of the death cases, they involve people who have not been vaccinated, and also in some cases involving children. We are very happy to hear that the services of the hospital authority are now operating normally. So having considered the situation carefully, then we will adjust our infection control measures in the following way. First of all, in premises where customers would normally wear masks, we would change the proactive check of the health code. We would change that to passive inspection. For example, in public entertainment premises, club houses, mahjong parlors, barber shops, beauty parlors, religious institutions, shopping halls, emporium, wet markets, supermarkets. Those who go there, we do not proactively check their health codes. People only need to scan the Leave Home Safe app, and then they can go into the premises. But if the law enforcement officers so request, they will also need to, cooperate. For catering premises, bars, hotels, spas, skating rinks, which allow customers not wearing masks, cinemas, performance venues, which allow customers to eat. Again, there will be a need for active or proactive inspection. Beauty parlors, massage parlors, nightclubs, karaoke establishments, sports institutions, swimming pools, and also cruises. again, we would require, proactive inspection. For passive inspection, in entertainment, premises, we do not, actively check. But if there is a skating ring there, which don't require the the customers to wear masks, then people entering the skating ring will need to be inspected. There are some premises which allow customers to eat. Again, we would require the premises to proactively check their health code. When you have people coming with a yellow health code, they are allowed to go into these premises, which only would require passive inspection. Secondly, administrative arrangements. At the moment, for the wet markets operated by managed by the government, our strategy will be aligned with those of private markets. There will not be any person at the entrance to actively, check your health code or your leave home safe out. So the requirement will be the same as those of the private market. Next, outdoor premises. As I said, for outdoor premises with good ventilation, we have reasons to believe that the risk is relatively smaller. For sports venue, outdoor sports venue, or the outdoor premises of the jockey club, we would allow people to eat. Also in performing venues, we would like to align that with our relaxed measures, so that for these performing venues, we would allow the the patrons to eat. Next, regarding camping sites and other outdoor recreational facilities, we will reopen all these premises which are managed by the government. Finally, for gyms, at the moment, we would limit each group to 12 persons, and there is also a requirement for those to maintain a social distance of 1.5 meter. We are now relaxing that requirement. That is, we will scrap the requirement for the maintenance of 1.5 meter. So we only required a gap of 1.5 meter between groups of 12. So these are the adjustments to the social distancing measures. I'd like to reiterate, because this is important, and I hope that members of the public and the members of the media would understand that the winter flu season is coming. For those who have not yet taken the seasonal flu jab, please, go and receive the jab yourself, and also take your family members to receive the vaccination. We need sufficient time for the body to get ready to defend itself against the virus. Next, there is discussion in the community regarding emergency measures. Like Dr. Zhuang said, the WHO still maintains that at the moment, COVID is still a pandemic, and we need to remain vigilant. It is still, that the world is still in a global emergency situation. For major public health incidents, we would need to have 3 levels of contingencies. In Hong Kong, we have an alert level, serious case, and the 3rd level is emergency. Under what circumstances would we arrive at an emergency status? There are certain conditions. First of all, there would need to be, an outbreak of the epidemic, and there would need to be effective measures to contain the epidemic. We need to have surveillance, and we have support of laboratories and infection control measures. And all these measures will involve cooperation among different departments and even cooperation at the international level. Normally, this will be spearheaded by the CE. We would call this the emergency level. Within the framework of the emergency level, we would map out a series of public emergency regulations, and we will contain the pandemic under the framework of the law. Overseas, other than the fact that the WHO still regard the pandemic as a global medical emergency, in the U.S. they have also maintained the extended the status as for 90 days. Although the epidemic has stabilized and the death rate has come down a little bit, I hope that the people living in Hong Kong and elsewhere would remain vigilant. We're still in the midst of a pandemic, and we must understand that the numbers have dropped because many countries no longer conduct tests, and many of them don't even report such cases. So I think the situation has been a little bit underestimated. Therefore, we need to stay vigilant in facing the pandemic. Next, regarding the order requiring the wearing of mask can help reduce risks. It can protect oneself and others. For people who don't know that they have been infected, if you put on a mask, this can help minimize or reduce the risk of infection. There are clinical evidence proving that masks are really very effective. For activities where people can remove the mask, we will regard those activities as high-risk activities. Furthermore, we are now approaching the winter flu season. Risk assessment, made the risk assessment, we do not plan to remove the order requiring the wearing of masks. On the 9th, the New England Journal of Medicine published a new article. This is actually an article put up by a U.S. scientist saying that in certain states in the U.S. they have already canceled the order compelling the wearing of masks, and they made comparison. Initially, the state of the COVID-19 situation is similar. After 15 months, they found that students in these two different states, they found that there was more infection for the state which have actually, done away with the requirement to put on masks. So this study proves that masks can really protect the public and reduce the risk of infection. I think that more or less is what I'd like to report, and I welcome questions from the media. So it's now Q&A time. So before you ask a question, please tell us the organization you represent and limit yourself to 2 questions.
On the second row, the one in green. I'm from Singtao Daily. A number of questions, please. First, about the vaccine pass. Why are you deciding to relax the requirement this way? What is the rationale for that? Now, you say you allow people to enter games center, or there's no need for proactive check, but then for skating ring there's need for proactive check. So with such partial relaxation, would it cause more confusion among the public? So because in the past there's complaining about inconsistency in your policy consideration. So instead, would you take a big step forward in relaxing measures so the public could better adapt to the measures? Now, you mentioned that for the death rate of the number of deaths cases, the number is is more or less stable. So in that case, can you not speed up your relaxation rate? Now, as for die with COVID and die of COVID is moved from 7 to 30% to now 60 to 40%. So does it mean that the epidemic now has less impact on the hospitals? So that's why some experts suggest that there is room for adjustment of infection control measures in hospital. For example, after patients are admitted, maybe say in the use of isolation wards, could there be some adjustment? So what are your views on that? Please allow the panelists to answer questions first. On the question about the hospital authority, I'll leave that to Dr. Lau. Now, about relaxing the requirements on vaccine pass, check. Well, actually, by relaxation, people still need a vaccine pass to go into certain premises. It's just a matter of whether it's a proactive or a passive check. Because clinical data show, of course, that vaccination is very important protection against infection or against the virus. Now, is it the case that our policies are confusing and not consistent? Well, just now I've spent some time trying to explain our risk management approaches. Now, for activities that require the removing of masks, for example, eating and drinking, there is a high chance of transmission. Therefore, we consider such activities as high risk. So for activities that don't involve taking off of the mask, then relatively speaking, the risk would be lower. So for premises where people go into and they don't need to remove the mask, then we see there is room for further relaxing the requirement to make it more convenient for the public. So that's what we have in mind. That's our philosophy. And how quickly or slowly we relax measures, it depends on our risk assessments. We also have to consider convenience to the public. So we have to consider a basket of factors in deciding how quickly or slowly we relax measures. But for high-risk places and activities, we are relaxing the requirements in a gradual and orderly manner. For places involving high risk, then the relaxation will come slower. Now over to Dr. Lau. Just now we reported death cases for the past week from the 3rd to the 9th of November, and we did an initial analysis. The analysis tells us that about 70% of the COVID-infected patients passed away and it's related to COVID. And then for 30% of patients, their death has nothing to do with COVID. It's probably because they were terminal cancer patients, or they had stroke, they had a heart attack, or they were admitted because of an accident. But it's just that at the same time we tested and confirmed they were infected with COVID, but their death were not related to COVID. And if we compare this data to that in the earlier stage of the fifth wave of epidemic, yes, is about 60 or 7%. I wouldn't say whether it's a high level or not, but then there are still patients who are infected with COVID and they are admitted to hospital, and the deaths are related to COVID. And we see in these cases, most of them were the elderly, and most of them were chronically ill. And so that's why, as Dr. Chuang mentioned, you could lower the risk of infected elderly patients becoming serious or even passing away with vaccination. So we see that the number of death cases have come down, but then we see that for most cases, death cases, there's a bearing on whether people had vaccination or not. So for the chronically ill, if they still have not been vaccinated, please do get vaccinated as soon as possible. And if you've had 2 doses, please make sure you take the 3rd dose or even the 4th dose. Apart from the chronically ill and the elderly, there's another group that we're very much concerned about, the very young children, infants and toddlers. In the past 10 or 11 months, the 10 children passed away because of COVID. It's really sad to see these cases. Now, in the past, maybe in a year, there will be 3 or 4 deaths due to seasonal flu. And here we see the number of death cases far exceeds that for seasonal flu. And then children have an even lower vaccination rate than the elderly. Well, even for the elderly, the vaccination rate is far from ideal, but for children it's worse. So that's why we hope parents will take their children to get vaccinated as soon as possible. You never know when a child may become infected, and you never know if the case would become a serious case or even a death case. Of course, we don't want to see this happening at all. One case is too many. And so you need to take precaution, and we need to take this step. Now, just now the reporter asked whether there are different arrangements for our wards. Well, our whole arrangement is risk-based. That's important. That means if for any patients, not only COVID patients, for any patients with infectious disease, and there's a chance of them passing the disease to patients next to them, then we will put them in isolation ward. It could be a patient with tuberculosis or other infectious diseases. So the same arrangement applies also to COVID patients, of course. That is, we don't want a patient to infect others after the patient's been admitted. As to how we deal with make our various arrangements, we have regard to the latest situation. We'll look at subvariants, identify, and we also look at the vaccination rate and so on. So we have to look at a basket of factors. Now, for our bed occupancy rate, so far is good. We have enough capacity, resources, and manpower, that is. So for non-emergency procedures and non-emergency services, they could resume to the normal level. We'll give others a chance, please. So to the left, the lady in black. I'm from Now TV. Just now there's mention of passive check of vaccine pass for certain premises. We see that very few people would actually scan the Leave Home Safe app when they enter a shopping mall. Wouldn't you think the vaccine pass is not working? And would you be carrying out more inspection to check if people have actually scanned their app? And is there still a point for people to scan the Leave Home Safe app? Will you still use the app to do contact tracing? Now, by law, people need to scan the Leave Home Safe app when they enter these premises. It's the same as you need to carry your identity card with you. Now, if you go to a shopping mall, of course you won't show people your ID card, but then if a law enforcement officer asks you to do so, you have to produce it. So that's the idea. Now, for people who go to shopping malls or department stores, they do have to scan the Leave Home Safe app because there's record to tell them where they've been. So it's a record for themselves. As for the Leave Home Safe app, it's still used as a contact tracing tool because we have so many cases now. Maybe in individual cases, especially for cases involving subvariants and there's a serious situation, then we do need certain tools for contact tracing, and the Leave Home Safe app does have this function. So we have no plan to remove the requirement for scanning the Leave Home Safe app because it remains a very important tool in our risk management.
The gentleman in white on the right-hand side. Good afternoon. You said that you want to increase the vaccination rate for young children. Yesterday, you started to administer the children's version of the BioNTech vaccine for those between the age of 6 months to 4 years old. So, what is the number of young children between the age of 6 months to 4 years taking the BioNTech vaccine? You also said that people are now allowed to eat in certain premises, or is it because after the Rugby 7 event, which was a pilot, and actually during Rugby 7, people could remove the mask for a long time. It's like the Premier League soccer matches, the spectators in the spectator stand, other than eating, can they also remove the mask? Could we ask the officials to answer your question first? I think you're talking about young children between the age of 6 months and 4. We only started the new measure from yesterday, so we don't have the number of such children taking the vaccine is still not very desirable. It's less than 20. So I'd like to appeal to parents that now that we have more choices, we have the BioNTech and the Sinovac vaccines. So with the coming of the winter flu season, I think the flu will have, grave impact on young children. So please take the opportunity to take your children to be vaccinated, because it's time for the body to build up the antibodies. So before the coming of the winter flu season, please take your children to get vaccinated. For the spectator stand, I think it's all about risk assessment. In an outdoor environment with good ventilation, there is more room for us to relax the restrictions. So for outdoor premises, we would like to, relax the requirement for passive check. As for whether or not we will make a further relaxation to allow people to eat, removing the mask, it's a high risk activity. All right, gentleman in black.
From the South China Morning Post. So the first question is to ask about why the relaxation of these Amber Code relaxation of these social distancing restrictions now for people with the Amber Code. Is it simply due to the perception of the fact that over the past events, the large-scale events that we have seen, and also tour groups being allowed to visit certain venues in Hong Kong, is it because that it's giving a perception that they have special rights or privileges? That's why you're doing this relaxation. And I just want to double confirm, does it mean with this further relaxation, people with Amber Codes will be able to enter venues that don't have the active checking of the Leave Home Safe or Vaccine Pass application? And the second question is to ask about the government's rationale on the continued use of the mask mandate. You explained that with outdoor activities with better circulation and ventilation of air, it would be relatively low risk. So why is the government still insisting on perhaps pushing forward with the mask mandates when it could potentially relax the mask mandate, for example, outdoor venues only, and not restricting mask use in all of the city? Thank you.
Okay. So for the relaxation, why now? Is it related to the event because of the event? It is unfortunate if the public correlate the events with the release or the relaxations of the oldest measures. Just what I have been, updating everyone here in the first half an hour about why we need to do the risk control. Where are the risks? I would say it's actually a balance between the risk that we have and also the measures that we are at hand we can do to actually control the risk. The whole relaxation is based on this balance. It's not because of the perception or that kind of issues. I'll just repeat, for the risk issues, if there's an outdoor activity, we believe that the circulation of the ventilation of the air or the ventilation is much better than an indoor, especially if the indoor is full of people are crowded. So this creates space, and this creates space for us to further relax the measures so that we can actually cater more people. So that we can actually cater more relaxation, and it's based on the risk of the risk control and the risk of the environment. And concerning the mask mandate, and I just repeat, for personal protection, mask is a very key protection for the individuals apart from the vaccination. And just mentioned about the study I mentioned in the New England Journal. We find that basically the study confirmed our belief that taking off the mask basically will got a rebound of the infection. So even in outdoor, the ventilation is better. We still need to protect we still to actually insert some kind of protection for the individuals and for the public. So for the mask mandate, at the current moment, is not a consideration to take it or to remove it. We still will actually have the mask mandate until the control of the pandemic or control of the disease is much better. So, 好，我哋下一個題目
Next.
Confirm it. I confirm that people with Amber Code can go to the premises without active checking. Okay.
左手邊最尾嗰行第一位。
First one to the left, first row. 7:30. Now the HA earlier announced that for the close contacts, you can, shorten the quarantine order so the people can go back to work earlier in the HA. Can you extend that to all members of the community? And secondly, after the relaxation, well, just now you said that certain government premises will become premises which will impose passive checking. Is it possible that for other government premises and so on, you can make a similar relaxation? Regarding masks, the Undersecretary said that you need to maintain the mask order. But could you make some relaxation? So, for example, people can remove the mask if there are no people, in the person's vicinity. I'll ask Dr. Lau to answer the question regarding the question of close contact. I think we've looked at many different studies. We understand that we have to strike a balance between risk management and manpower deployment. Starting from a few days ago, for our staff who are close contacts, after they've actually comply with all the arrangements. For example, they have to take a PCR test every day. While they are performing duties, they must, put on surgical masks and eat alone. Under those conditions, we can arrange for them to return to work. Since on day one, we have 80 odd staff who apply. And today we have 120 odd staff applying to return to work. We will monitor the situation to ensure that our staff will abide by our requirements, especially the requirement for tests and putting on their mask. We believe that this arrangement will not increase the risk of infection for staff and patients in our public hospitals. Would you extend the relaxation to the other, industries or sectors? You've heard Dr. Lau said that when you go to work, you need to abide by many rules. So at this moment, we have no plan to make that relaxation you suggested. Now, I hope members of media would understand that vaccination is the best way to protect oneself, followed by the wearing of masks and the frequent washing of our hands. So we want to protect the public. So relaxing the requirement for vaccination, I think at the moment we still maintain that we need that arrangement. Regarding libraries and schools, we're talking about administrative measures here. So the premises concerned can make their own decision, and there is no need for a proactive check. As for relaxing the mask mandate, I repeat that, in terms of risk management, the ultimate defense would be vaccination, masks, and washing of our hands. So at the moment, we have no intention to relax the mask mandate. We'll now take the last question, the lady on the right.
My question is still on Rugby 7. Just now, said that people were allowed to eat and drink at the Rugby 7, and it went on for 3 days with tens of thousands of people wearing masks, eating and not wearing masks, eating and drinking. So there should be high risk. So have you found any confirmed cases among the spectators? If not, then we could see that when the risk is not so high, the wearing of masks may not be essential. If that's the case, how come for other eating establishments or people still have to wear a mask to watch a performance, or whether there is still a cap on the number of patrons? Why wouldn't you relax it? Second question, you say that for those with amber code, they could enter premises with passive check, and then for school groups, those with amber code could go in and out as these premises as a group. So what is the arrangement? What would be the level of infected cases before you terminate these policies or measures? And also, would you reduce the number of PCR tests for arrivals? Instead, would you go for a daily RAT test? Which organization do you come from? RTHK. Now, for the Rugby 7 tournament, you saw only photos of people not wearing masks and eating and drinking. But actually, much was done to prepare for this. Now, first, this is a special large-scale event with special arrangement. For those entering the premises, they must have done a rapid antigen test. They must have been completely vaccinated. And then the relevant organizer must have a way to manage and make sure these measures are implemented. In other words, people are fully vaccinated. And then for those entering the premises are not high-risk groups, not the old, the young, and other high-risk groups. So you see what's on the surface, but that's because much has been done behind the scene. But can we relax this arrangement to the entire community? well, if we do that, well, there's probably some way still for us to go for that in our day-to-day activities, but the things are looking bright, and there is probably room for further relaxing the various measures gradually. As for Amber Code holders, you asked how many of them became infected. Actually, you're just asking about the number of confirmed cases for arrivals. For new arrivals into Hong Kong, now, of course, if there is a bigger number, then there will be more people found to be infected. I think the case is the same for local infection cases. Now, if someone is tested positive by PCR, then the code will become a red code, so these people could not enter these premises. So it's the same measures for people who've been infected. Thank you very much for coming to the press briefing. Thank you. Those are two separate issues. First, for the emergency level, well, we'll have to see whether there's room for adjusting the measures. In some places, we're seeing a rising trend, and in Hong Kong, things are still, stable, and so we have regard to the situation and make adjustment. But in this circumstance, it won't be suitable. Thank you.